Hi everyone, my name is Monica Gurung.
Hi, my name is Yaqi Zhang.
My name is David Wang.
And we'll be presenting on travel policies and its effect on COVID-19 cases.
At first, I'm gonna talk about the timeline of the epidemic in China. In December 2019, patient with unexplained pneumonia appeared in Wuhan. On January 23, 2020, Wuhan announced the closure of the city. The city's buses, subways, airport, and railway stations from Wuhan were temporarily closed. The closure of Wuhan contained the spread of the epidemic throughout the country. From February 4 to 19, the number of new confirmed cases besides Hubei showed a downward trend consequently. On April 8, Wuhan lifted the ban. On April 26, all hospitalized cases in Wuhan were cleared. The COVID-19 occurred during the Spring Festival of 2020. Many people went back to their cities. Therefore, during the Spring Festival of 2021, to ensure safety, the government issued a policy that people with trans-provincial trips must have a valid negative result of the COVID nucleic acid test within 7 days before traveling, and then need a 14 days quarantine time at home. Next, I'm going to talk about the travel ban forced to the abroad. Next slide, please. From March 12 to 19, 2020, the number of imported confirmed cases account for 84% of the total newly confirmed. March 16, all overseas entries must be quarantined for 40 days in the city of entry. March 29, 5-1 policy was implemented. It means one airline, one country, one rule, once a week. This policy resulted that the inbound passengers dropped from an average of over 25,000 to around 3,000 per day. On November 6, 2020, bubble inspection policy was implemented. This policy states that passengers who take flight to China must present a negative nucleic acid test and a certificate of negative IgM antibody test within 48 hours before. And then they also need a 14 days quarantine at the city of interest. And next slide, please. And this slide is the current epidemic situation in China. Next, we will gonna talk about the epidemic in the United States.
Okay, so for the United States, on January 20th, the CDC says there's three U.S. airports, the JFK International Airport, Los Angeles, Los Angeles Airport, and San Francisco International Airport, where began screening for coronavirus. On January 21st, the CDC confirms the first coronavirus cases happened in the United States. On February 2nd, the global air travel is restricted, and the people who go to the United States, they have to left China or they can face a 2-week home-based quarantine if they had been in Hubei province before. And mainland visitors, they need to undergo health screening upon their return. On February 2nd, there are total 11 people get COVID-19 in this time. On March 13th, the travel ban on non-US citizens traveling from Europe goes into the effect. The Donald Trump administrated travel ban on non-American who visit 26 European countries within 14 days of going to the United States. The people traveling from the United Kingdom and the Republic of Ireland are exempt. On September 14th, the US airport stopped screening international travelers. The flight will no longer be redirected and all passenger screen will be halted. On November 20th, the CDC warning against holiday travel. So there are total 32 million people that got the coronavirus during the pandemic, and there are almost 575,000 people was killed by the coronavirus, and there are 24 millions and 423,000 people they got recovered. So for next part, the New Zealand, Monica will talk about it.
So the first COVID-19 related travel ban was placed by New Zealand on February 3rd of 2020. New Zealand had no reported cases of COVID at the time, but as soon as the news of a person dying of COVID in Philippines got out, New Zealand banned the entry of any foreigner who was traveling from or through China. They still allowed their citizens to return back as long as they strictly followed the 14-day quarantine rule. New Zealand's first case of COVID was confirmed on February 26th of 2020 when a woman who had returned from a trip to Iran tested positive. Since 26 people in Iran had died because of COVID at that point, New Zealand placed a travel ban on Iran too. On March 19 of 2020, the Prime Minister of New Zealand, Jacinda, announced that they were placing a complete ban on any non-citizen entering the country. The ban applied to tourists, international students, workers, basically anyone who required a visa to enter New Zealand. Although the previous bans exempted people traveling from the Pacific Islands, this ban now applied to them as well. So, as we can see on this page, the total coronavirus cases found in New Zealand were only 2,524. Only 26 people died of coronavirus in New Zealand, and out of the affected people, 2,424 recovered. Next, please. So, some of the reasons why New Zealand has been able to control the spread of COVID so well, other than the travel bans, are masks, their COVID tracer app, and their COVID alert system. The entire country of New Zealand is on level 1 right now. It means that there are no too few cases, but they're taking precautions to not spread the virus. Public places like gym, malls are open, but they wear masks and still maintain the 6 feet distance to make sure they don't spread the virus. And level 2, 3, and 4 just built up on the previous levels by adding more restrictions on the number of people in gatherings, limiting national travel, and such. Next page, please. Comparing the infection, death, and recovery data between these three countries, we can conclude that travel ban decreases the number of infection by limiting the movement of people who want to travel from a non-infected area to an infected area and vice versa. Mandatory COVID-19 test for people who want to travel from one country to another also limits the number of infected people who could possibly transmit the virus. Having several levels of travel bans for differently affected towns, cities, and states helps the country to recover faster and help things go back to normal. Next page, please. And these are some of the references that we used.